Don't ever let your physician or ER doctor ignore these 5 rare but serious L5-S1 disc herniation symptoms or L4-5 disc herniation symptoms. If you're struggling with back or leg pain from an L5-S1 disc herniation or an L4-5 disc herniation, and you feel overlooked by doctors, if you're tired of waiting for answers, if you feel lost without clear guidance, and you're desperate for real solutions, then please keep watching this video. In this video, not only will I outline and describe in detail how to identify these serious L5-S1 and L4-5-S1 disc herniation symptoms, but I'll also guide you through the steps to take immediately after noticing these symptoms. And if you've already tried these steps and still haven't found the relief of answers you need, you're not alone. In this video, I'll talk about a key aspect often overlooked in handling lumbar disc herniations and introduce you to groundbreaking non-surgical treatments that target the root cause of the disc injury. If you miss any part of the video, it could be the very reason that you continue to suffer and develop into a permanent chronic disability. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. I'm the author of 10 books, the founder of National Health Day in Canada, and I'm very honored to say we've been voted Ottawa's best 16 times. As well, I've had the privilege to work with some of the world's best athletes. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs or surgery. Now, first, I want you to understand that these 5 symptoms of serious L5-S1 disc herniation or L4-5 disc herniation are rare, but you must know about them. If any of these symptoms occur, you must immediately go to the emergency room where they may admit you into urgent surgical decompression surgery. Now, what are the 5 symptoms of serious L5-S1 disc herniation symptoms and L4-5-S1 disc herniations? They are symptoms associated with something called Cauda-Equina syndrome. So what is Cauda-Equina syndrome? Well, one of the things I try to do in my videos is to make things easy for you instead of using big fancy terms. So understand, okay, we've talked about this before, you have a spine. Okay? The spine is made up of vertebrae. Those vertebrae, okay, are going to have a vertebrae, there's going to be a disc, there's going to be another vertebrae, another disc. Coming out at each different level are the nerves. Those nerves come right off the spinal cord, which is inside there. What a disc bulge or a disc herniation is what happens is when that disc actually bulges out, and when it bulges out, it puts pressure on the nerve. Okay? That is not good because it's going to affect wherever those nerves go to. Now, where this plays an impact in Cauda-Equina syndrome is this big fancy term. Equina comes from equine, equestrian. It just means horse. Okay? Cauda is typically just referring to the end of something. So think, what's a horse's end? Its tail. So although we've just shown you the spinal cord, and then you're led to believe that that goes all the way to the base of the spine, it actually doesn't. Okay? When the spinal cord gets to about L1, so that's your first lumbar vertebrae, it actually turns more into nerve-like, like the horse's tail. Okay? And in Cauda-Equina syndrome, what happens is you can get so much pressure from that disc herniation that it actually starts to compress those nerves. And when it does that, it's going to affect wherever those nerves go to. So again, think of your nervous system as like the hardwiring of your computer or your body's own internet system, or in the old days, the electrical wiring in your house. If you start to compress or irritate or impinge or disrupt that nerve flow, wherever those nerves go to will be affected. So they don't just go down they won't just cause low back pain, they're going to go down the legs. So that's often when you'll feel that numbness or tingling or pins and needles and so forth. But those same nerves go to the bowel, to the bladder, to the reproductive organs. They're going to go to anything in that area or close to that area as well. So it's rare that a disc is going to herniate so much to compress the Cauda-Equina nerves. But when it does, you can have some serious issues, and it's a serious condition that will require immediate surgery. So what is symptom number 1 that we need to be concerned about? Symptom number 1 is what I refer to as bilateral sciatica. So bilateral just means it's happening on both sides. So we can understand, you may be suffering from sciatica. You understand that typically comes down the back of the leg. When we get to the point where that's happening down both legs at the same time, that's a far more serious sign. That's an indication that you may have cauda equina syndrome, where the disc is actually bulging or herniating back directly into that canal, directly on those nerves, and you need to get to the emergency room of your hospital. Symptom number 2 is what we call saddle anesthesia or saddle paresthesia. And again, just big fancy words. So saddle, I want you to think of, if you're riding a horse, you'd be sitting on a saddle. And any of those areas that are essentially contacting that saddle are going to be affected. So this could be anything from the genitals, the anus, the inner thighs, the back of the buttocks, and so forth. Any of those areas at all. And anesthesia versus paresthesia. Anesthesia, just think of anesthetic. Think of an anesthesiologist putting you to sleep. So with saddle anesthesia, what we're getting is you actually get a complete loss of sensation in that saddle area and in through the anus and so forth. That's a very serious sign. Saddle paresthesia is going to be more what people often feel with low back pain, also not good. It's going to be the pins and needles, the numbness, the tingling, but again, all in that saddle area, the anus, the genitals, the inner thighs, and so forth. Again, that's a serious sign. You need to get yourself to the emergency room of your closest hospital. Symptom number 3, we were just talking about how those same nerves don't just cause pain, they don't just go down the legs, they don't just cause numbness and tingling and pins and needles. They control organs, they control the bowel, the bladder, the reproductive organs. Symptom number 3 is bladder dysfunction. So by bladder dysfunction, what I mean by that is we're talking some serious bladder dysfunction. It could be bladder dysfunction where you actually lose ability to function, lose control of your bladder. Okay? That's a serious sign. It could be something where you're actually getting what we call bladder retention. So your bladder is filling up, but that nerve has been so affected, it's not sending that message to the brain, letting you know to actually urinate as well. These are serious signs that are coming from that disc herniation, compressing that nerve. You're cutting off your body's own internet system. If you can't go 24 hours without emptying the bladder, that's a serious sign. That's, again, emergency. Get yourself to the emergency room of your hospital. Serious symptom number 4 is bowel dysfunction. If you can't do number 1 on the toilet, you're also, you're now at the point you can't do number 2 either. So bowel dysfunction is you either losing control of your bowels. It's something where you just can't have normal bowel movement. Now again, this is different from people who are constipated. It could be that if you're under the care of a medical doctor, they may have put you on drugs that may have side effects causing some of this as well. So you need to know the difference here. But if you've actually lost bowel function, if it's something where there just can't be a bowel movement, again, that could be compression coming directly onto those nerves from that serious disc herniation. And again, if you lose bowel or bladder dysfunction, that is emergency surgery. Get yourself over to the ER right away. Symptom number 5 is what we call motor weakness. And now again, let's make this really simple. When we say motor weakness, what does that mean? Well, motor is what moves your car. It's what drives the car. So motor weakness, we're talking about, what actually gets those muscles to work, actually moves those legs. So if you get motor weakness in both legs, again, that's an indication that it's coming directly on the cauda equina nerves there. It's actually, there's enough compression, enough dysfunction that has actually stopped your ability to actually be able to walk normally. If you get to that point, again, a serious problem. That's a significant amount of compression on the nerves. If you don't deal with that, you'll get to the point where you could very easily become disabled, and you could lead to a permanent chronic disability. Get yourself off to the ER as quickly as possible. Now, what are they likely to do at the ER, the emergency room? Well, if you get diagnosed with cauda equina syndrome, again, they may proceed with emergency surgical decompression surgery. That has a host of side effects, obviously, and obviously a significant, issue, something that has to be addressed. There's no two ways about that. If you have any of these symptoms and you went to the ER and you feel they ignored you or ignored your concerns, it's always wise to get a second opinion. This is not something that you can mess around with. And if that fails, you still can't let this progress. Now, if this has ever happened to you, please tell me in the comments below. I'd like to hear from you. Perhaps you've already tried some conservative treatment options that have also failed you. Let me know that as well. Now, in my 30 years of working with disc bulge and disc herniation patients, I've seen many treatments fail because the true underlying cause of the problem wasn't found. How on earth do you fix something if you don't even know what's causing it or even that it exists? And often there's not just one, but almost always it's more than one that is missed. Okay? That's why you need a comprehensive initial consultation and examination. I'm going to outline what makes our initial consultation exam so thorough and unique. And after that, I'll introduce you to our distinct method for treating severe spinal issues like chronic L5-S1 disc herniations or L4-5 disc herniations. And I'm going to detail how we've provided thousands of successful treatments to help patients avoid surgery in the first place and regain a pain-free life. Please keep watching. Now, our consult begins, are you ready for this? A thorough history. I know that sounds so basic, but essentially we listen to you. How on earth do you ever find out what's going on with a patient if you don't actually listen to them? Let them tell your story. They know better than anyone. You know better than anyone what's been going on. So we need a thorough history from you. I'm going to want to know what you do on a daily basis, what injuries, what accidents you've had, what you're feeling, when it affects you most, what makes it better, what makes it worse, and so forth. We will do something very unique, something called a full spine nerve scan. So we have the technology in the office where we can also analyze your spine. We don't need to wait 6 months for an MRI. We can do a full spine nerve scan right on site in our health center. We will do diagnostic digital x-rays, possibly even motion x-rays, again, something that is rarely done anywhere else. If you have MRIs or CAT scans, please bring them in. We're going to review those for you as well. We will do everything from range of motion testings, orthopedic tests. We'll look at your posture, how that's affecting it. We're going to look at how your body's compensated, and that's an important factor as well. Muscle testing, and also most importantly, I'm going to put my hands on your spine. Right? This is not something that we just talked in a Zoom call. I will put my hands directly on your spine. I have laid my hands on hundreds of thousands of spines, all to get to the underlying causes of what's creating your problem in the first place. And then after pinpointing all of the causes of the disc herniation, we develop a tailored treatment plan aimed specifically at addressing each of the spinal issues that we've just identified, always specifically to you. At the heart of that is something called robotic laser spinal decompression. It is incredibly unique. It is patented, revolutionary technology. We have the only system in all of Ottawa. There are only 12 of these worldwide, and it literally gets to the root cause of the herniation to give you long-lasting results. But a combination of spinal decompression and Class 4 laser, which is the highest level of laser that's approved by Health Canada and the FDA, which truly overcomes any of the past difficulties people have had. We add a number of things to that. And most people, they have lost the connection of their brain telling these muscles how to work. So we go well beyond any type of core exercise. We're going to get into what's called neuromuscular reeducation. We're going to provide you with nutraceuticals specific to start to heal that disc, to actually rebuild it, to actually heal the nerve, to bring down inflammation naturally. We do something very specific called neurospinal correction, where again, we'll get the alignment back into the vertebrae. We do muscle tissue restoration, where we can break up the adhesion in the scar tissues. And then at the end of any of our programs, we're going to do a progress exam. I know that sounds almost overly common sense, but this is not something where we want to cross our fingers and hope. We actually want to measure objectively just how well we improved you functionally. Because if we can do that, that's when we're finally getting long-term correction. That's what's going to get you back to the life that you deserve. Listen, we know how to find it. We know how to fix it. We've helped many just like you before. Now, I understand you've been through a lot, and I want you to know that there is hope. This channel is all about that, offering hope and assistance to people like you, guiding you towards finding relief and reclaiming the quality of the life that you deserve. I'm here to share knowledge, strategies, stories of healing to empower you on your journey back to wellness. In my videos, I discuss treatments, exercises, lifestyle changes that have helped many, many others and could potentially help you as well. Now, please stay with us and let's start moving towards a healthier, pain-free future. Now, I want to hear from you. Please tell me your experience with L5 and S1 and L4, L5 disc herniations and disc bulges. What's worked for you? What has not worked for you? Comment below and let me know. If you found value in this video, go ahead, like it, share it now, so we can help more people suffering with back pain, leg pain, disc herniations get some hope as well. It also helps with the YouTube algorithm, so we can help more and more people. Please be sure to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. Now, please watch this video next, where I share 3 inspiring success stories of patients who found relief through non-surgical robotic laser spinal decompression. It's a must watch for anyone seeking alternatives to surgery for back pain, leg pain, or disc herniations.